8 weird skin signs of kidney damage you must not ignore. Your kidneys might be failing, and your skin could be the first to know. That itch that won't go away? That yellow tint no concealer can cover? Or the swelling that makes your shoes feel 3 sizes too small? These aren't just surface issues. They're early warning signs that your kidneys are struggling, and they're quietly calling for help in the only language they know. The truth is, over 800 million people worldwide may have chronic kidney disease, but the vast majority of them, about 90%, have no clue. Because your kidneys are the ultimate silent workers. No screaming, no aching, just quietly losing ground day after day. They filter 45 gallons of blood daily, working around the clock without complaint, until they simply can't anymore. By the time symptoms appear on the outside, your kidneys have been in trouble for a while. But there's still time to act. If you're over 50 or living with diabetes, high blood pressure, or obesity, you're at higher risk. In this video, we'll walk you through 8 skin-related signs of kidney disease and what you can do to catch it early, stay ahead of dialysis, and protect your health. Before we dive in, please note, all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. These skin changes vary in significance. Some clearly signal kidney disease, while others might point to a range of medical conditions. 1. Itchy skin, pruritus. Picture this. It's 2 a.m. on a Tuesday. You're not awake because of a noisy neighbor or a bad dream. You're wide awake because of an itch so relentless, it feels like an army of tiny ants marching in formation under your skin. You've tried every position, every sheet, every distraction technique. But the itch persists. This isn't your garden variety mosquito bite or dry winter skin itch. This is uremic pruritus, and it's one of the most common skin symptoms when your kidneys are in trouble, showing up in as many as 40% of people with end-stage renal disease, or ESRD for short. For many, it's the first red flag that something's seriously wrong. When your kidneys can't effectively filter out waste products, urea builds up in your blood like sediment in a clogged drain. This accumulation leads directly to that unbearable itching sensation. It can occur anywhere on the body, but often strikes your back, legs, and arms. During the day, distraction helps. But at night, sweat makes it worse. Dry skin intensifies it. Heat turns it into absolute torture. What starts as just scratching quickly becomes something far more serious. Constant scratching creates scrapes and open wounds. Your skin begins to change, thickening, turning leathery. Raised bumps called prurigo nodularis dot your arms and legs like a topographical map of discomfort. Once your skin barrier breaks down, you've essentially opened the door for bacteria. What began as an itch can spiral into dangerous infections. And hey, if this feels helpful so far, let us know you're out there by tapping that like button. It tells us to keep making content just like this. 2. Swelling. Your wedding ring stopped sliding over your knuckle 3 weeks ago. Those leather shoes you've worn for years now feel like torture devices by mid-afternoon. When you press your thumb into your lower leg and hold it there for a few seconds, the dent remains like a fingerprint in wet sand. Your kidneys normally function as your body's personal bouncer, escorting excess water and salt off the premises. When kidney function declines, these unwanted guests overstay their welcome, setting up camp in your tissues. The result? Swelling, or as doctors call it, edema, particularly in your hands, feet, ankles, and face. The distribution tells its own story. Gravity plays a role, so swelling typically starts in your lower extremities. Stand or sit for long periods, and your ankles become the collection point. Lie down, and the fluid shifts upward, sometimes creating a startling morning face you barely recognize in the mirror. Try this simple test. Press your thumb into your lower leg and hold for a few seconds. If it leaves an indentation, what doctors call pitting edema, It's time to check your kidney function. 3. Changes in skin color. Your mirror reflects a stranger these days. That healthy flush in your cheeks has been replaced by something you can't quite name. Maybe it's a yellowish tint that foundation can't mask, or a grayish pallor that makes your friends ask if you're feeling all right. When your kidneys struggle to filter waste, your blood becomes a repository for toxins that should have been eliminated. These accumulated wastes literally change your skin's appearance from the inside out. The yellow or gray cast isn't just cosmetic. It's a chemical transformation visible to anyone paying attention. But color changes don't stop there. You might notice hyperpigmentation, dark brown patches emerging across your skin as melanin builds up in places it shouldn't. If you're looking paler than usual, that's often anemia talking, a frequent companion to kidney disease. Then there's something that sounds like it belongs in a Gothic novel: uremic frost. After particularly heavy sweating, some kidney patients develop a white, powdery residue on their skin. It's like your body is trying to sweat out the crystallized toxins your kidneys can't filter. And note that excessive scratching can also change your skin's color and texture. 4. Dry skin or xerosis. Your moisturizer has become your most constant companion, yet your skin still feels like old parchment. You apply lotion after every shower, keep tubes in your car, your purse, your desk, but moisturizer seems to evaporate the moment you apply it. Simple movements stretch your skin to the point it might crack and bleed. Dry skin affects between 50 to 80% of dialysis patients, making it one of the most common symptoms of kidney disease. When kidneys fail, multiple body systems cascade into dysfunction. Some people don't drink enough water, ironic, since too much fluid can be dangerous for kidney patients. Others find their sweat glands barely function anymore. Long-term diuretic use strips away what little moisture remains. And high vitamin A levels, which sometimes result from kidney issues, can turn skin into a desert. What starts as typical dry skin morphs into something more serious. Your skin becomes fragile, prone to cracking with the slightest movement. Simple actions, reaching for a cup, turning a doorknob, can split your skin open. The real danger? These cracks become a highway for bacteria. What starts as discomfort can quickly escalate to serious infection. Curious about the science behind it all? We've linked the studies that support everything we've shared. You'll find them down in the description box. 5. Rashes. These aren't the rashes you'd expect from new laundry detergent or a spring walk through poison ivy. People with advanced kidney damage develop something called acquired perforating dermatosis, a mouthful for what looks like small, pigmented, itchy bumps with scaly centers. These bumps can usually be found on your arms and legs first. Sometimes they venture onto your trunk, scalp, or buttocks. What makes them particularly frustrating isn't just their appearance, it's their stubborn persistence. Just as some bumps begin to heal, newcomers emerge nearby, creating what dermatologists describe as lesions in multiple stages of healing. Eventually, they can join together into larger patches. Here's where the cruelty intensifies. While these rashes itch terribly, scratching provides only momentary relief followed by increased irritation. The bumps can break open with scratching, leading to scars and more problems down the line. 6. Blisters. They appear without warning, fluid-filled sacs that emerge on your skin, usually choosing the most visible spots. The backs of your hands, your forearms, occasionally making surprise appearances on your feet or face. These aren't the friction blisters from ill-fitting shoes or burn blisters from touching a hot pan. These are systemic blisters, a sign your body's balance has shifted. The size also varies. Some blisters remain barely noticeable, while others grow impossible to ignore, stretching skin taut like tiny water balloons. They may be accompanied by other symptoms, such as pain, redness, and swelling. Kidney damage is just one potential cause of blisters. Blisters can be caused by infections, medications, poor diet, and heavy alcohol intake. What makes kidney-related blisters particularly troublesome is their aftermath. Unlike simple burns that heal with minimal scarring, these blisters often leave permanent calling cards. As they heal, they frequently create scars and skin discoloration. 7. Calcium deposits. This is where things get serious and scary. Calciphylaxis sounds like a science fiction term, but it's a real condition that strikes up to 4% of dialysis patients, representing one of the most severe skin manifestations of kidney disease. It begins with painful pink or purple bumps or plaques, typically on your abdomen, buttocks, or legs. With time, these bumps transform into deep, excruciating ulcers covered with black crusts. The risk factors create a perfect storm: high blood calcium levels, long-term dialysis, obesity, certain medications that affect calcium metabolism. The prognosis varies dramatically depending on early intervention. Caught early, aggressive treatment can halt progression. Delayed diagnosis often leads to limb amputation or death. A related but milder condition, calcinosis cutis, presents differently. Here, calcium deposits form firm white nodules near joints. Sometimes these calcium collections break through the skin's surface, releasing a chalky white discharge. While generally not painful, when these deposits form in fingers or toes, every movement becomes a reminder. 8. Hair and nail disorders. Your bathroom mirror tells a story you'd rather not read. Your hairbrush collects clumps that seem to multiply daily. Your nails tell a similar story: white horizontal bands, color changes, strange ridges. These might seem like vanity concerns, but they can be important indicators your kidneys need help. Hair loss, medically called alopecia, can crush your self-esteem, but the causes run deep. Severe nutritional deficiencies in iron and zinc, hormone imbalances as your kidneys struggle to regulate multiple systems, and medications, including some blood pressure medications and immunosuppressants that fight kidney disease but sacrifice your hair in the process. And dialysis treatments can strip hair of its natural oils, leaving it dry, brittle, and prone to breakage. Nail changes often appear earlier than hair loss, making them important early warning signs. Lindsay's nails show brown at the tips and white or pink at the base, a distinctive half-and-half pattern. Me's lines appear as single or multiple white bands crossing your nails horizontally, often corresponding to episodes of severe illness. Sometimes one will see splinter hemorrhages, tiny red or brown lines that look like actual splinters under your nails. They're caused by small blood clots, damaging the delicate capillaries underneath. In one study of 100 kidney disease patients, nail changes appeared in 60%. Another study found hair, nail, and mucosal disorders in 23 to 45% of dialysis patients. When to seek help. We've covered 8 significant skin signals, but here's the crucial question. How do you know when it's time to see a doctor? Some symptoms scream for immediate attention. Calciphylaxis demands emergency intervention. Other signs whisper warnings that gradually crescendo into emergencies. If you're over 60 with existing conditions like high blood pressure, diabetes, or obesity, even seemingly ordinary skin changes deserve attention. Your primary care physician should typically be your first stop. Blood work and urinalysis will either confirm your concerns or provide reassurance. You must communicate well with your doctor, who can explain your condition and how to prevent further skin changes. For severe or persistent skin symptoms, especially those affecting quality of life, you should see a dermatologist or skin doctor who can collaborate with your nephrologist or kidney doctor. What you can do. Post-diagnosis, medication might be necessary, but it's far from the complete solution. Your daily choices profoundly impact both your kidney function and skin health. Dietary modifications form the foundation. A kidney-friendly diet means monitoring sodium, protein, phosphate, and calcium content. Work with a renal nutritionist to develop satisfying meal plans that naturally align with kidney-friendly requirements. Plus, try to quit smoking and limit or avoid alcohol consumption. Hydration becomes surprisingly complex with kidney disease. The old 8 glasses a day advice doesn't apply when your kidneys can't process fluids efficiently. If you have kidney issues, especially if you are on dialysis, overhydration can lead to fluid buildup. To manage thirst when restricting fluids, eat pieces of frozen fruit, drink small sips, or rinse your mouth with mouthwash. Work with your healthcare provider to establish personalized fluid goals. Skincare takes on new significance. Daily moisturizing isn't optional, it's a medical necessity. Choose fragrance-free, hypoallergenic products. Avoid using harsh soaps and skincare products that can irritate your skin. Emollients containing ingredients like salicylic acid or urea can help penetrate thicker, compromised skin. Modify bathing habits. Hot water strips essential oils from already fragile skin. Keep showers short, use lukewarm water, and pat rather than rub skin dry. Immediately apply moisturizer to lock in moisture. Sun protection becomes non-negotiable. Choose broad-spectrum sunscreens with SPF 30 minimum. Use it even on cloudy days and reapply it throughout the day. Physical sunblocks containing zinc oxide or titanium dioxide often work better for sensitive kidney skin. Plus, wear protective clothing. Choose loose-fitting, comfortable clothing made from natural fibers like cotton. This allows your skin to breathe. And never underestimate the power of regular checkups. They're essential for monitoring kidney function and catching new problems early. Use these appointments to discuss any changes or concerns. Conclusion. Here's what matters most. Your skin is talking to you. Whether it's the maddening itch of uremic pruritus affecting 90% of hemodialysis patients, the telltale swelling of fluid retention, or the intricate nail changes signaling deeper systemic issues, these aren't random occurrences. They're your body's distress signals. Early detection dramatically improves outcomes. Blood tests, urinalysis, and specialist consultations confirm what your skin has been telling you. Treatment protocols become most effective when implemented before damage becomes irreversible. Remember that managing these symptoms extends far beyond prescription medications. Small, consistent adjustments in daily habits can significantly improve both kidney function and skin health. Many patients find that focusing on skincare provides a sense of control when kidney disease feels overwhelming. Your body has been sending you messages. The question is, are you ready to listen? We want to thank you for being here, for listening, for having the courage to embark on this journey of discovering what truly benefits your health, a journey that isn't easy, but is worth more than anything else. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Concerned about kidney disease? Your kidneys might need a natural boost. Check out our next video about the top 5 fruits that can help cleanse your kidneys naturally. We'll share evidence-based tips to maximize their benefits. See you there, stay informed, stay healthy.